Hello everyone, it's an absolute pleasure to be at the second of our online workshops with you all. My name is Tracey and I work with Joanne and Gillian at the School of Nursing and Midwifery, Queen's University, Belfast. During this short presentation, I want to introduce you all to the research priority setting exercise that we will be continuing with on our in-person visit to Colombia. As with the Spark SP aspect of the workshop, this research priority setting exercise will be co-designed with you as experts in providing care to those with cancer and requiring palliative care, or those of you with lived experience of cancer. So Joanne has already provided some background on what co-design means during the first workshop, but as a very brief recap, co-design refers to a participatory approach to designing solutions, in which key stakeholders, and by that we mean all of you who have been invited to be involved in these workshops, so where you are all seen as equal collaborators in the design process. Core processes of co-design include building trust with each other, making sure everyone has a voice, that everyone shares their perspective, and also creating a common vision for change. Most importantly, research has shown that this is the best way to ensure we meet the needs of those we are conducting the research for. The purpose of this aspect of the research is to work together to build the evidence base for integrating palliative care and oncology within Colombia. So to do that, we need to find out what are the most important questions for patients, their families, and healthcare providers in Colombia, so that we know what the research priorities are and what we need to focus our efforts on doing. To do that, we are soon going to be moving into a short discussion session focused on the following two questions. So the first question is around what you think are the priority research questions in terms of integrating palliative care alongside oncology in Colombia. So really it's about finding out what do we not yet know that we need to know to improve care. And then moving on from that, we want to know what you think are the challenges to conducting research and what are the potential solutions. So when we talk about challenges, this could be in terms of the design, and by that we mean how we actually do the research. So for example, if the priority research questions indicate that we need to use a survey questionnaire to lots of people in Colombia, would there be challenges in getting people to respond? And if so, what could we do to encourage as many responses as possible? So these are the type of things we want to be discussing together. In terms of next steps, we will be gathering today's thoughts and ideas from you all, and then we will be feeding those back in terms of forming a basis for further discussion in workshop 3 and then subsequent workshops in person when we actually get to visit you in Colombia in February. So just to thank you all for listening and to say that I am really looking forward to hearing your thoughts on the questions and also really looking forward to meeting you in person in February. So thank you all.